New tonight, concerns are growing over a tuberculosis outbreak in Kansas City, where nearly 140 people have been affected.
And while TB is rare in the U.S. today, local health experts say outbreaks like this are a reminder that the disease can still spread under certain conditions. 44 News reporter Courtney Green has that story new tonight.
Tuberculosis, or TB, isn't something most people think about anymore. Once common in the 1930s and 40s, medical advancements drastically reduced its spread. But in Kansas City, health officials are tracking an outbreak. 67 active cases, nearly 80 latent infections, and at least 2 deaths.
Don't see a lot of it anymore. You do see a related one in HIV patients that are badly immunosuppressed. It's called Mycobacterium avium intracellulare, but you really don't see that much tuberculosis anymore.
Health officials haven't pinpointed the exact source of the outbreak, but cases have been reported in Overland Park, a Kansas City suburb.
So if I had to guess, it's probably coming from one spot where these people have been in close proximity to one another. That's about the only way you could spread that much of it among that many people.
So what does this mean for the tri-state? According to Dr. Martin, the risk of tuberculosis spreading in this area is incredibly low.
Do I see a chance of it being in this area from that? Not likely. Usually with tuberculosis, it's very close contact over a fairly long period of time. It's not like you walk in the room with somebody who has TB and you pick it up. It's more along the lines of you live with somebody who has TB, and over the course of a month or so, you've picked it up.
Unlike common infections, TB requires months of treatment to fully eliminate it.
It's not one of those, we're going to treat it for 10 days and you're over. It's more like we're going to treat it for 6 months and you're over. It's very hard to get rid of.
Experts say while the Kansas City outbreak isn't a direct threat to Evansville, it highlights the importance of screening, especially for those in healthcare, shelters, or high-risk environments. Reporting in Evansville, Courtney Green, 44 News.